So you're welcome to come around and watch the treatment being done, ask any questions. Just a quick little background. Dr. Glenn has been a NeoGen owner for, I think, 2 years now?
It feels like three.
Three.
It's
Yes.
almost three now.
Dr. Glenn, I'm sure you've probably seen her all over social media. She was featured on Vogue magazine as using NeoGen to treat melasma, one of my favorite articles. I saw you just on Forbes, I think, last month as well. So you're catching on like fire on all these articles. So we're really excited to have you here. Any questions that anyone has, feel free to ask her and come on up, watch the demonstration, and then we'll watch the presentation after.
So we're going to do a lower energy today. I'm going to start at 0.8. The reason being is because she says herself, I have sensitive skin, and she's also a phenobarbital. And my concern is photosensitivity. I just want to make sure that she's comfortable. So you said Jackie, correct?
Right.
Yes, Jackie. So Jackie's main concerns today is she had cystic acne in the past. She's been on Accutane. She has some residual scars, and she's looking to just improve the overall quality of her skin. Hi, how are you? Sorry.
Oh, yeah.
Hi. So yeah, she wants to improve the quality of her skin and then treat some of the acne scarring. So she's been numbed with topical. Is this BLT, benzocaine, lidocaine, tetracaines in here? Okay, perfect. And then we need to put a hydration mask on top of it as well. I typically numb for anywhere from 45 minutes to an hour, regardless if my patient's doing a low energy or high energy. And then to determine what energy level I'm doing, there are several factors that come to play. A few things are going to be, what is the goal that they're hoping to achieve? Are we just looking for some resurfacing? Are we looking to treat melasma? Are we looking to actually increase the collagen and elastin production? Are we looking to do all of those things? So if you are a lower fits, then I can go up. I usually don't pass the 1.4, 1.6 range. I know other providers do, but mainly because at that point my patients are usually just looking to have skin tightening, skin resurfacing. And then if we're treating melasma, I typically, for most patients, I'm in the 0.8 range, because with melasma I'm treating you as a higher fits as well. And then for my patients who naturally are a fits 5, 6, or 4, I'm doing low energy, usually at 0.8. Very rarely do I go to 0.7. Most of the time I can treat 0.8, and as long as they're pre-treated with a tyrosinase inhibitor, I don't have any issues with any complications or PIH. And then even in some patients who are fits 3, around fits 3, I'll treat them with high energy. If they tan, let's say they're biracial, black and white, or they have like an Asian descent, I'll go ahead and pre-treat them and then do high energy to not get any PIH. But I mean, when I tell you I've been able to treat basically patients of all different skin types, ethnic backgrounds, and as long as you're paying attention to them and you're tailoring the treatment specifically to their ethnic background, their skin, their fits, etc., you can have a very successful treatment without any complications. So she's numbed. What do we have stuff to remove it? Need something to remove the numbing. Do we have? If we have gauze, do I have like a glove? Okay. Gauze, glove, and then So the device. You have your tank in the back. Have you guys seen this device before? Yeah?
A lot of people here have.
Okay. So nitrogen gas is in the back, 100% pure nitrogen gas. It's heated up in the generator. It's going to come out through the handpiece as nitrogen plasma. I'm going to change the hertz to 2.5. We have the low energy 3-pronged nozzle. I'm going to turn the energy up to 0.8, and then after wiping off the numbing, then we'll start our treatment. Can I give this to someone?
Yeah.
Thank you.
Oh, what size is this? Okay.
Yep.
For most of my patients, we're treating your face and your neck. I try never to neglect the neck. And bars. Okay. If you guys have any questions as I'm going, please ask, because then it'll just be like this awkward silence. And I'm like, I love to talk to people, so please ask me questions.
I got one. What percentage of your clients are, fits 5'6"?
I would say about 75%, 60 to 75%. Sorry, you said 6.
Well,
Well, higher fits are going to be about 60 to 75%, but fit 6 are much lower, maybe like 10, 15.
okay.
And I've done NeoGen treatments on that as well.
Do you still use 0.8, or are you taking it down a bit lower?
0.7.
Okay.
That's usually the only time I ever go to 0.7. I really don't use 0.6. The only time I ever used 0.6 was during my training, and I had a fit 6. And after that, I was like, no, I'm gonna go a little higher, and it's been fun. I think the most important part with any NeoGen treatment is the prep and communicating proper pre-treatment with the patient. It reduces the risk of complication, paying attention to the skin, making sure you're asking appropriate questions, making sure your patient's not traveling before or after, making sure they're wearing sunblock and compliant. I typically will have them send a photo. If I'm becoming a little worried, or like if after the treatment I'm like, maybe I should have went a little lower, I'll have them send me a photo just so if I see like something, an issue may arise, I can get on top of it. Once in a while I do also use a topical steroid. I'll use like a or something like that. Just for in between the hydroquinone. So I'll do 1 week hydroquinone pre-treatment, and then I'll do a topical steroid for the 3 nights post, and then on night 4 they restart hydroquinone for a week, and that works like a charm.
Which concentration hydroquinone did you use?
It is a low, it's like
We use up to
0.0.
4%.
Huh?
We use up to 4%.
I think the one I use is a little lower.
Okay.
Yeah. I'm forgetting off the top of my
No
head which
problem.
prescription, what strength it is, but it's a lower strength. Let me see, do I want to sit? It's a little low, yeah. And I think I need to get rid of these gloves because they're too big for me. Okay.
We have small gloves.
Yeah, I can't. The large ones are. Although the blue isn't very pretty.
Black is
Yeah.
more safe.
Yeah. Thank you.
This might go up as well.
Oh, it can go up. Okay, great. Thank you. Yeah, getting comfortable is very important. Every time I move, can make the treatment feel like way more work than it needs to be. Thank you. Okay, so you're gonna, do we have earplugs? No, right? Okay. You're gonna hear a popping sound. It sounds louder than it feels. It sounds scarier than it feels, but it's gonna feel like a ball of warm air, kind of like a sunburn or oven heat, a ball of oven heat hitting your face, okay? So, so this is what it sounds like. Oh, warming up.
Happens to me every time
I
I say
know,
that. I'm
I
always
know.
like, never mind, psych.
Yeah, every time.
I always do that before I do it at their face, though. Like, just hear it once.
Okay, there we go. So warming up, now it's ready. So that's what it sounds like, okay?
Okay.
And then I'm gonna do a test shot right on your cheek.
No, I understand.
I'll do this side for the cameraman.
Are you ambidextrous?
I do, yeah.
Yeah, you do both hands?
Mm-hmm.
Don't see
It
that very
depends
often.
on which angle I'm, I like to be as comfortable as possible. Okay, so her skin's just fine. I'll do 0.8. If you feel like you're not having any issues, you're tolerating it, we can always go up on strength, okay? All right, so I'm gonna work around your jawline. Do you wanna come on this side? Or you wanna stay over there? Okay. Okay, here we go. How's that feel? So I always start at the jawline. I bring it all the way. No, you're gonna just stay.
Oh, I thought you was turning me along.
I'm gonna move you around. I'm gonna do all kind of things, and you just stay put.
Okay.
Thank you.
You're welcome.
So I'm gonna pull the skin and get, with the gravity, a lot of times the skin can kind of like fall back around the ears, and I want to make sure that I'm getting the full surface area. So when I get close to the ear, I pull the skin upward, and then I get to basically the full area. No area left untreated. I do a double pass by the jaw. I make sure that all the pulses are very close and overlapping. You're gonna stay still for me, okay? Alright. And then after I do that double pass there, then I'm gonna just go in
The opposite direction, is it?
Yes, exactly.
Like crosshatch. yeah?
Exactly.
Would it be okay if I did a live video?
You can film, sure.
Yeah, I doubt anybody will join, but we'll give it a go. Thank you. You're in the way.
How you doing?
Mm-hmm.
Do you feel it?
Mm-hmm.
Okay, so we're gonna stay right here at 0.8. So I find that with my more fair skin patients, heat doesn't retain in the skin for as long, so the tolerance for the heat is a lot higher versus with my higher fits. It feels hotter to them. That's just because the heat is kind of just like accumulating in the skin a little bit more. So they usually aren't able to tolerate like a 0.8 on someone that's a fits 3 or 4. It's more painful than someone who's a fits 1 or 2, from my experience. I just think that with melanin-rich skin, they're just holding on to that heat longer, and then it's accumulating at a faster rate versus with lower fits, the heat kind of like dissipates a lot easier. That's my assumption. I also find that the thinner the skin, the more uncomfortable the treatment is. So for patients who are more mature in age, if they're in their 70s or older, a lot of times, especially around the forehead, the cheeks, they will.
If so, does the melanoma patient feel more pain?
Say that again?
If so, it is in more darker skin patients has a more heat inside.
From my experience,
Yeah, yeah.
but
What about the melasma patient?
Same thing, yeah.
So you feel more free?
In my opinion, yes, because they're holding on to more heat. It's not that the pain, it's significant where they're, they don't want to do a treatment anymore or something like that. I just noticed that maybe they'll flinch a little bit more compared to someone else with the lower fits.
How many passes you do for a certain area?
I do 2 to 3 passes. So, like in the jawline, the entire face, I do 2 passes. If there's an area where I really want to address like nasolabial folds or someone has a scar or there's like the eyes, for example, I'll do 3 passes. And then I'll just go back over that one area. Sometimes I'll change the energy level. Maybe I'll turn it up a little bit or turn it down a little bit. It just depends. So after doing the jawline, now I'm contouring the cheeks.
You treat everywhere with the same energy?
No. So my treatments range from 0.7, which I rarely ever use 0.7, but from 0.7, and I go up to about 1.4. I personally just don't go up higher than that. I know other providers do. And then the level that I treat, it varies depending on the patient. I completely customize it depending on their fits, their past medical history, if they're on medications. Those are all things that I consider. So, like, for this patient, I would have easily gone up to a 1.4. I would have, and I always prime the skin first with a 0.8 anyway. So I start with 0.8 for all patients, and just to prime the skin and get it ready to receive that higher level of energy, and then I will switch the handpiece, go up to a 1.4 or 1.2, and then do a second pass around the entire face. And then my third pass is in areas that I really, really want to target. So especially jawline. Like I have a patient who she's getting ready to have submental liposuction done. So I did 3 passes in her neck and submental region and in the jawline and in the nasolabial folds.
With 1.2, 1.4?
So her first pass was 0.8, and then I did a 1.2 and 1.4. Yeah. And her healing process, she healed extremely well. Like she peels, like it looked like a chemical peel, but she wasn't extremely raw or red. Like she looked really, really good. She was even, when she sent me a photo, she was like, Dr. Glenn, am I supposed to, are things supposed to look more aggressive than this? And
How many days?
This was around day 4 or 5, typically when you start to see more of the peeling process. And she still looked really well. She was going to work just fine. Other patients with more mature skin or in thinner skin, I find that they peel a little bit more aggressively. But that patient in particular, with 3 passes, her healing process was really, it wasn't as aggressive as I would have expected.
Are most of your patients coming in for one treatment or multiple treatments?
I rarely ever do one treatment because, okay, that's not true. One treatment if we're doing high energy.
Okay.
So high energy, one and done. You get one treatment, and then in 2 years, we're booking another session. And I couple my treatments with a lot of other things. So I do full face optimization in my practice. A lot of my patients come in for full face rejuvenation, but in a very natural way, where it just looks like they're refreshed. So I usually start with the NeoGen treatment because I don't believe in using injectables as, a way to make you look younger. It doesn't do that. It just adds shape and volume, and that's about it. And you still want to also use it very judiciously so people can maintain their identity and you're not just creating a dysmorphic face. So I always explain to my patients that the aging process is on a cellular level, and we need to target, the actual deep dermis of the skin, stimulate the collagen and elastin, and treat things at the base or at the root. And then after I do a NeoGen treatment, then I go in with other procedures. So maybe I'll do stem cells. So I'll do topical stem cells after a NeoGen treatment while the skin channels are open.
Immediate after?
Stem cells, yeah.
Immediate after.
Yeah, while the channels are open, it's
Yeah.
the perfect time to put anything topically onto the skin. So I have a beauty hacking practice. We're hacking your DNA to regenerate the architecture of your skin. NeoGen is the perfect beauty hacking device. So I'll do a treatment. I'll put topical stem cells on after. I may inject a little bit under the eyes. And then after the NeoGen treatment, once they're fully healed, 2 weeks later, they come in and then we'll do their injections, because you can't do injections 2 weeks before or 2 weeks after the NeoGen. So if I'm doing some cheek fillers, some Botox, maybe a little bit of chin, maybe a little bit in the lips, just to hydrate and plump. So maybe I'll even do a little bit of threads at that time. It just depends. So it's very rare that my patient ever comes in just for a NeoGen treatment unless they found NeoGen online and they were like, I found you, you're in New York and I want to get a NeoGen treatment. But even then, we're still typically coupling it with something else to optimize them and do like that complete full face optimization. If I do high energy, it's one and done, one NeoGen treatment. If it's low energy, on average, I do 2 to 3 treatments. The first session, my patients always see a benefit. They always see the results. I tell them that 3 low energy treatments is going to be equal to 1 high energy. The first session, they love it. They love the results. They get that immediate resurfacing. They may not see the skin tightening right away. Like they get the tightening from the heat initially, but after they heal, they may not see the tightening right away. But if they have melasma, they definitely see improvement in the melasma in the first session, and they get the improvement in the quality of the texture of their skin, the pores. By the second session, collagen production for sure. So my publicist, for example, she raves about the NeoGen because she's prepping for her wedding. She's done 2 sessions, and she's just done she did her second session. She went to get a lymphatic facial, and her facials was like, oh my God. She's like, Janelle, your chin, it has so much more collagen. Like that, those were her exact words. And she had no idea that she went to get a treatment done. She had no idea she was working with me. And she was like, oh my gosh, it's the NeoGen. She was in Beverly Hills at this gala. She had no makeup on. And everyone in there just kept complimenting her skin. And it was really a combination of things, the NeoGen definitely, and using medical grade skincare. She uses my medical grade skincare, but it was that combination of the NeoGen treatments, just tightening and improving the quality and elasticity of her skin, and then also just using great medical grade ingredients. So typically, I start with the jawline, I work my way around the nasolabial fold, then I'll do the upper lip, I'll do the chin, I'll bring it up to the nose, go around the forehead. Sometimes I'll do the eyes right away, sometimes I'll save the eyes for last. If I do high energy, sometimes I usually will save the eyes for last, because with most of my patients, I have to do a little bit of a slower pulse just so they can be more comfortable. The eyelids are really thin. Everyone's going to find their own technique. Everyone does it different. Here we go.
What do you mean with high energy, for example?
Mm-hmm.
What is the meaning of high energy? So
Yeah.
1.4, 1.6.
So low energy is up to 0.8. So the low energy tips have these 3 prongs. That's how you know you're using a low energy nozzle. These prongs basically are the plasma energy. There's more width between the energy leaving the device and it actually touching the skin.
Nice.
So it lowers the joules that are essentially getting into the
And
dermis.
how much later you do the second treatment?
4 to 6 weeks.
4 to 6 weeks.
Mm-hmm. So then the high energy is a slightly different tip. There's only one, and it's a lot shorter. So the tip is a lot closer to the skin. The energy is getting deeper into the skin. You can feel it more. It's just stronger, more higher joules.
Yeah, just a little bit of extra information. Dr. Glenicia Nosworthy is absolutely correct. We have 2 nozzles, which is a low energy nozzle for energy levels of 0.5 to 0.8 joules, and we have a high energy nozzle, which is there we go. Thanks, Justin.
Yeah.
It's got a shorter standoff, and it means that you're closer to the skin, and you can work with a power power envelope of 1.0 joules to 4.0 joules. So that's how we differentiate, and there's many ways of delegating this technology within a practice as well. You can delegate just using nozzles. You can delegate using the administration functions on the device as well. You can give somebody access to the low energy settings, which can work up to 1.5 joules. Does anybody else use it in your practice, Dr.? No?
At this moment, it's just
you,
me.
yeah. So they get a special
Look,
treatment, yeah.
They love it. They're like, "Are you doing my treatment?" Yes.
Yeah.
But to be honest, if for me personally, because I'm very particular, and then because I do work with a wide range of patients with different ethnic backgrounds, my biggest concern is just making sure that they're pre-treated if they need to be. Because as long as they're pre-treated, you can have a very safe and successful treatment. So even if I hire an esthetician or someone else to do the treatment, I would do the consult, create the protocol, and then hand it off. And do I have to do the treatment? No. But having a proper system in place is how you can still have a successfully ran practice with minimal complications. I'm not going to say without, because things can always happen. But in my opinion, if I were to ever delegate, that's how I would do it.
Do you ever treat any celebrities?
Yes, I do.
Yeah,
I can't give names away, but I have celebrities that are getting. So, I mean, the days of procedures that look overdone or injections that look overdone are really outdated. Everyone is looking for natural things that they can do to enhance their beauty from the inside out on a cellular level. So in my presentation, I'm going to talk about this, but my concept of beauty hacking was developed because of that. Because, you know, if we give if we give the body the tools that it needs to regenerate, we can do amazing things. We don't have to rely on synthetic injectables, etc. So my patients, a lot of them have tried other devices in the past, and they either complained that they didn't really see great results, or maybe they had some fat pad loss, or they felt like it was just extremely painful. And then when they try the NeoGen, they absolutely love it. Their pain level the significance is very much so there. Like, some people would say that they've had other treatments, a radiofrequency microneedling treatment, for example, and they said the pain level was about a 10, and they've done a low energy NeoGen treatment, and they said their discomfort was a 3 to 4 out of 10. So it's a lot more comfortable. Their downtime is minimal. I have celebrity patients who will come in, they'll do a NeoGen treatment, and then 3 days later they're on set, covered up in makeup, and you'll never know that they had a NeoGen treatment, but it's a part of their maintenance. And that the person in particular that I'm thinking of, that's on a very prominent TV show right now, she has melasma.
Right.
And that's why she was referred to me, because of the melasma. And it has definitely lifted her melasma a ton. And not only does the patient say it, but all of her makeup artists are reaching out to me and telling me how much improvement in her melasma. So with melasma, the makeup artists have to do a lot of work with different layers of foundation to basically camouflage the discoloration. So sometimes you have to make someone darker than they naturally are to make their makeup look good and blend. And the makeup artists are very, very pleased with the improvement in the melasma, and then also in the quality of her skin as well. And she loves it. She's had 2 sessions so far. I'm not great at talking
You're doing great.
and NeoGening at the same time.
It's very interesting to hear how it's really working in your practice. I think that's really meaningful for people to understand.
I truly love my device. My patients are happy. And I think that's the most important thing. They get a good return on their investment. Especially doing it in combination. I think doing a layering and a series of regenerative treatments is really the trick, not just relying on one thing. I think the NeoGen is great on its own, but when I combine it with, like stem cell therapy or medical grade skincare, nutritional supplements, PRF treatments, that combination I feel gets patients really great results. It always takes time, because like filler is something you see right away, right? But nobody wants that anymore. They rather take the time and make the investment and improve what they have naturally, because that's going to prevent them from having to reverse and undo and fix things in that more bigger ticketed procedure that they'll have to do down the line. So.
Yeah. So, and this regenerative wave that seems to be, getting stronger and stronger. That sounds like that's the forefront in your practice.
It's the forefront of the world. So, I mean, we know, I'm basically doing my presentation right now. Because as we know, how many of you consider yourself a biohacker, or you know someone who's a biohacker, or you've heard of the word biohacker? Because this is biohacking. Like, this is beauty hacking. I coined the term beauty hacking for that reason. It's me using a lot of the regenerative and anti-aging benefits in the field or in the world of biohacking, because the whole world is realizing the power that they have just by eating well and grounding and doing the things that Mother Nature gave us, right? Like, plasma is Mother Nature. This is lightning in a handpiece. So, like, how amazing is that? So I think the world is really realizing the power of our own bodies and regenerative treatments, and beauty hacking is doing the same thing. And it's basically using the concept of biohacking in the field of beauty. And that's what I call the NeoGen. I call it a beauty hacking device.
Did you go on to some program in the last couple of months, like a TV show and talk about this? I've seen you on the news or TV programs at least 2 or 3 times.
Yeah, maybe.
Yeah, I think so.
Yeah.
I think so.
Yeah, I'm always talking about what's important to me somewhere on some outlet. Because honestly, I just love what I do. And I think it's a beautiful thing to be able to have an impact in someone's life in a way that, like, using your skill set. So I'm always talking about beauty hacking and, the tips and tricks that I'm doing in my office, because it's meaningful to me. And I want people to realize that there are resources and alternatives out there that can help them to take care of themselves and to look and feel their best.
Yeah, I really like the fact that it's encouraging, the skin to show its best side. It's all very natural.
When you have beautiful, glowing, radiant skin, to me, that is your purest form of beauty. Like, I felt the most beautiful externally when I can wake up in the morning, wash my face, look in the mirror, and be happy, right? So if the NeoGen is going to help me to get there, and it's natural, then bring it this way.
Bring it on.
I would have probably done her treatment a little different, but because I'm talking and stopping and talking and stopping.
Yeah, I'm getting to see that your overlap is very good. So the patient is going to have a very good outcome.
See, I'm missing space, right? So
I think
always,
that's one of the challenges, is actually trying to get those pulses close together.
yeah. I look for an even sheen. Anywhere I see a dull spot, go back and treat it. So around her eyes aren't treated, and then we'll start treating around the other side of her face. Any other questions?
When you're treating like skin type 5, for example, what kind of improvements in the skin do you get to see?
Okay, well, you get that immediate resurfacing, and I'll tell you what my patients text and call me and say. So, oh my gosh, Dr. Glenn, my pores are gone. Like, I used to be able to see my pores. Now I don't see them anymore. I had these fine lines in my forehead. This is one treatment, by the way. One treatment at 0.8. I had these fine lines in my forehead and they're starting to fade. Some of the fine lines are already disappearing after one session. My skin is just like more glowing and radiant. This patient in particular is using my skincare and the NeoGen. We started her on Glow by Glen medical grade skincare 2 weeks after her NeoGen treatment. And then I got a call from her about a month later. I always wonder afterwards, like, I didn't hear from them. Like, what's going on? And then the call always shows up. I had another patient, she was a Fitz 5. She wasn't even, my medical grade skincare line wasn't even out at this point yet. But right after her treatment, her daughter said, "Mom, you look like a walking filter." Because her skin was just glowing and her pores were really smooth and kind of like airbrushed. And that patient also had three treatments of radio frequency microneedling in the past. And she wanted to forfeit her money because of the level of discomfort, and she didn't really see much of a result. But after that first NeoGen treatment, not only did she see that improvement, but her family members also were complimenting her. So, yeah, my patients, Fitz 5, the few that I'm just thinking about right off the top of my head, they all have phenomenal results and they all love their treatment. I've never had a patient say that they're not happy with their treatment. Maybe some people rave more than others, but I've never, ever, ever had a patient say, "I didn't see improvement, I'm not happy with my results, it was a waste of time, it was a waste of money." Never.
Cool. I think that's a lot to do with the technology, but also a lot to do with you and your technique. You've got great technique.
Thank you.
Some of the improvements that I've seen on skin type 5 is some patients can have like a darker circles underneath their eye.
Yes.
And maybe over the top lip.
Yes.
Have you seen improvement in
Yes,
these areas?
absolutely. So when I'm treating patients with hyperpigmentation under that, so different types of dark under eyes, right? You have vascular, you have thin skin, you have hyperpigmentation, which is melanin production that's under the eye. Usually genetic, sometimes it could be other factors as well, but I have a multi-tiered approach. For one, I want to make sure they don't have any nutritional deficiencies like vitamin D, iron, etc. And then I will put them on medical grade skincare, and I will do a regenerative treatment, whether it's plasma like injected plasma, PRF under the eyes, or NeoGen, or sometimes both. But even if I had a patient who just did NeoGen under the eye, especially if I'm doing it with the pre-treatment, because the hydroquinone, when I'm using it with the NeoGen, it just allows it to work better and more efficiently. So for my patients who have melasma and I don't use hydroquinone on them, I don't get as great a result as if I'm using the hydroquinone. So that combination of the medication and the NeoGen, I feel lifts melasma really well and pigment in general. There was one more thing that I was going to say.
Was it about the top lip part? Or was
No.
it about the three things, like nutrition, skincare?
No, it's
No?
fine. But yes, I do get great results with the under eye. Oh, this is what I was going to say. If you ever have a patient who has like a bruise under the eye too, like let's say they had like a procedure, or you dissolved filler, or they just have like some hemosiderin staining under the eye, the NeoGen actually treats that really well. Like I've had patients who had hemosiderin staining from filler that they've had placed, and they had like, it was a poor outcome, and then we dissolved it, and then I did a NeoGen treatment, and then the hemosiderin staining lifted really quickly.
Nice.
Mm-hmm. So yeah, this is me doing the left hand.
How's the patient doing? Yep, we got a thumbs up.
She's comfortable, not a flinch in sight.
She looks very comfortable. Is it are you in Brooklyn or?
I am. I'm in Dumbo, Brooklyn. I'm right on the water. My father's had a NeoGen treatment.
Yeah?
Mm-hmm.
What
A
does he
soft
think?
blepharoplasty. He loved it.
Yeah?
Mm-hmm. He's 77 years old.
Yeah, I don't think there's any upper age limit for NeoGen.
Oh, I've done NeoGen treatments on 90-year-olds.
Whereas probably with other devices that might be
Yeah.
non-advisable.
Yeah, especially if they work really deep in the skin.
Mm.
That wouldn't probably be the safest thing for them.
So we're using 0.8 here. So we're probably heating the surface of the skin to about 90 degrees, but we're doing it very, very quickly with in like microseconds. So it's comfortable at 0.8. But then when you get up to 1 joule and above, you do need some help with the top as well.
Maybe turn just a little bit for me. Perfect.
Did you get a chance to look around at ASLMS before you arrived, or you
Not
came straight
really.
here?
I came
Yeah.
straight here. I'm a woman on a mission.
You're behind you.
Oh, hi. Did you get the shoes?
You get what you need?
Like, you gotta get the good angle of me pressing on the pedal. That's always the hidden touch in the videos.
Oh,
Yeah, that's my thing. You gotta get the good designer shoe pressing on the pedal in
I
the
did
video.
notice there was a match with your shoe and your tie.
Hello. Gotta match the shoe with the tie.
Did I see you puffing on a cigar recently?
Yes, you did.
Yeah? Where was that?
I was at an event that my friend invited me to on the water.
Was it good?
Yes, it was. I love whiskey and cigars.
That's it.
You know, my last name is Nosworthy.
Mm-hmm.
My first name is Glenn.
Glenn, I know. It's
And you know, the
Scottish.
Glen, yes,
Yeah.
so the whiskey, the cigar, hello, it's me.
Well, in that case, I think mine needs to be Simon IPA Jones.
You know, we have this conversation. I remember you do like IPA.
Yeah.
I'm gonna do this side of the nose.
You're coming up to doing the eyes soon, are you?
Yes, I usually like to have a little shield, but I'll just not get
What,
far
like a
enough
squeeze?
from.
There's two things on top
Okay,
of that.
cool, perfect. All right, here we go. Just gonna cover up your lashes. You okay?
So what you're doing there is protecting the lashes, yeah?
Yeah, so I cover
Not
up
the-
the
sorry, the brow,
lashes.
yeah.
I'm pulling the lid up
Oh,
with
yeah.
this. Yeah, so I'm covering the brow, but I'm using this to pull the lid so I can get the full surface area of the upper eyelid.
Okay.
So as long as this is on, the handpiece is on a 90 degree, you know exactly where that plasma energy is going. If you're tilted, it's going to go in the direction of the lash. So you keep it like this. You get pretty close. And you just do some upward strokes.
So this is the real, well, it's one of the real benefits of NeoGen. There's no ocular shields required, so you don't have that difficult process for the patient in terms of loading those ocular shields. It's thermal energy, so that's why you don't need the ocular shields. I think from earlier presentations we heard from Dr. Bacciarina that you get a 25-30% linear contraction in the eyelid.
You can already see this eye is lifted higher than this one. If you come from this angle.
Contraction. How long does it last, immediate contraction for you?
I'm not sure. How long does it last?
I'm not sure.
That was a question for me, and that was a good question.
Yeah, I don't know
think
how
it's
long it lasts.
40 up to the 2 days. Then it's deflation.
Yeah, and then the actual collagen stimulation.
Yes,
But I know for a fact it does do a soft fluff because of my father. Like my dad, he has ptosis of his right eyelid from a car accident that he was in. And he needs a blepharoplasty. Like it was his lid was obstructing his vision, like his lateral field. And we did 2 or 3 low energy sessions on both of his eyes, but a few more passes on the right eyelid. And it's, even though he still has some ptosis because it was very significant, he's not obstructing his vision anymore. So he's very happy with that. You do get that immediate contraction, but still you get the long-term benefit as well.
Any idea, Jerome, what kind of average period the kind of tissue settles down before it kicks in on the collagen?
It's going to take 2 or 3 days.
Yeah.
So typically I would do like double pass. It wouldn't just be one, but
Okay.
we're gonna keep going for time's sake.
I'm just going to ask questions to the patient. How does that feel to you? As a kind of half a third. So this is a little bit more.
And that's why with high energy, that's why I save it towards the end, because I know with high energy, it's a little more uncomfortable. The eyelids are thin.
Yeah.
So you're doing this everything the day, one day. Long team, short team, high energy on the lids after this at the same time.
Say that one more time.
Same day procedure will be low energy and high energy on the lid.
So yeah, I always, if it's a lower fits patient and I'm doing high energy on them, I will do 0.8 first, no matter what. Like I always prime, and then I still go in with high energy same day. You can do 3 passes easily on the eyelids. Like I'll do
So you will
0.8.
do this and then switch the tip.
Yeah.
Why you don't do the small tip right away?
I prime the skin. I prime everywhere, including the eyelid. The way I was taught to do it.
What is the science behind that?
I think it's a basic. The coverage is important to treat the whole skin, and then applying the extra energy in the areas where you're either going to you want the energy to get the extra tightening or improvement in the problem that you're trying to fix. This kind of low high has actually started to happen in the last couple of years. Mainly from Sean Charles. They started this is the first time I saw it in terms of using base and then adding either the way they do it is that they do 0.8 and then they put half of the face at high, or they choose half of the face at high. So that's the way that.
And I do it different. I will still do the whole face high.
Okay.
And then in some areas, I'll do another, like especially in the nasolabial fold or along the jawline, I'll do another like 1.2 in that area again.
So your high is no more than 1.5?
Yeah, I don't go past 1.4 really. And that's just what I'm comfortable with, because I still see great results with that energy level. But I'm also doing several passes. So
And would you do that with Fitzpatrick 6? You can go up to-
I don't go past 0.8. Yeah. With 5 and 6, Some 4s, it just kind of depends. I don't go past 0.8.
So what is your highest 3? 4.
Let's do.
I think the high low idea is like you're going to
So NeoGen can be used not just on the face, we can use it on the neck, on the hands, on the décolletage, anywhere really.
Yes, anywhere there's skin.
Mm-hmm.
And honestly, the neck is. I have some patients who come in strictly for that reason.
And what, is it about the wrinkle improvement or is it about the tightening?
They just
Or the
notice
crappy skin?
laxity. They see they take a picture and their face looks good, but their neck doesn't. And over the years, we spent so much money on skincare, and it's a testament to show, like, okay, you take care of your skin, and you're gonna slow down signs of aging, which is great. But a lot of people forget about the neck, and then it's their son's wedding, and they're taking pictures, and then all of a sudden, they see that their neck looks older than their face, and
But NeoGen can bring that back up to
oh yeah.
the right place.
So I there's a patient in mind that I'm thinking of, and it was her son's wedding that she went to, and it was the picture of her neck that she was unhappy with. And we did one. She's a FITS 1. We did one low energy treatment at 0.8. And she was supposed to come back for her second treatment, but her schedule got really busy. By the time she came back for her second treatment, it was already almost 3 months later. I took another photo at that visit and then did her second treatment. But when I looked at her before and after photo, day and night. And that was only one session.
So Dr. Bacharina, who's opposite you here, is showing us photographs of how she's used, well, either 1.3 joules treble press, yeah, or a single 3 joules, yeah. So
What do you use the 3 joules for?
Eyelids, face,
Yeah.
scars, body,
Yeah.
abdomen.
I want to be brave enough to do 3. I haven't wanted it. I just haven't done it. The other thing too is I want to make sure, because my practice is smaller. I think once I have like more,
You have a different demographics.
Yeah.
Mine is the Caucasian white. Sometimes we have Native Americans in the blood, Asian. You have more African American and the Hispanic and the Colombians, right?
But I have a lot of Caucasian patients as well. I just don't go up as high.
Are you able to use injectable lidocaine?
Yeah. I didn't even think of that.
That is
I love that.
With the eyelids. It's injection the same like they do in
Yeah.
blepharoplasty. You're doing the same injections to do the treatment for the eyelids.
See, this is why we're here. So we, because I'm like, I want to make sure my patients are comfortable. I feel like going up to 3, they're not going to be comfortable.
You have to do that.
Yeah.
You have
Okay.
to love them.
There we go.
Do you use Pronox at the same time?
And I don't use Pronax either. I just use topical.
No, I do use Pronox, yeah. You can prescribe.
Yeah, I'm an MD. Are you okay down here? I'm gonna stop it right after this. We didn't knock down here. That's what you're feeling. We're almost finished. Just gonna get this last little line.
The whole 3.0, but the results is very
Just gonna get a little closer on your top lip, okay?
We just had a study done, and it showed that we can get 21% improvement in the wrinkles on the top lip. That was right, isn't it?
Barcode lens, yeah.
Yeah.
And that's an area that people really, like the smokers lines, like they're really, really,
Quite tough, aren't they?
yeah.
Are we?
How do you feel? You did it.
I did it.
Congratulations.
Thank you.
You're welcome.